myself in that I joined Columbia Surgical Associates in 2018. I'm a board certified in vascular surgery, general surgery, and surgery critical care. I received my undergraduate degree in medical education at the University of Missouri, Kansas City, and graduating in 2010. Then I completed all my 8 years of training at UMKC and St. Louis University, finishing my vascular fellowship at St. Louis University in 2018. I then joined CSA and I've been here since, loving every minute of it. This is a little bit about me, a picture of myself and my husband, Jason. We're at the top of the mountains in Colorado in Vail, doing some skiing for the first time, which I wasn't very good at. I like to stay on the blues and greens, but I did have a good time. This is another picture of our dogs, Millie and Lila, two Shiba Inus that we have that are about 1.5 years old now. And then another picture of my husband where we like to go climbing and do some adventurous stuff. We're, again, up in some mountains in Colorado. So what is vein disease? It's a circulatory problem in which the veins in your legs are not effectively pumping the blood back up to your heart. We find that it's due to non-functioning valves within these veins. As you can see on the picture on your left of your screen here, a normal vein has these paired cups, and as the flow should be going up towards your heart, if that pump of mechanism stops for a brief moment, as in you pause walking, for example, where your calf muscle isn't squeezing at that moment, then the blood would tend to run down towards your feet with gravity. But with intact working valves in a normal vein, those valves should stop the blood flow at that point. And therefore, with each effective pump of your calf muscle when you're doing exercise or walking and such, it keeps opening and closing with the pressure changes at those valves, ultimately moving all of that blood up towards your heart. But when you have dysfunction or non-function of those valves for multiple of reasons, which we'll go over, those valves won't potentially even come together and reach each other in order to stop that blood flow and keep it from running down towards your feet. And those we call venous reflux. They can lead to things such as varicose veins and a variety of symptoms that we'll talk about. The symptoms and causes overall can vary, but if left untreated, some serious complications can proceed, and we'll review that here briefly. Minimally invasive treatment options are available to treat vein disease, which is my main emphasis today. So causes of vein disease, as you can see, it's a good list here of things that can cause vein disease, particularly with prolonged standing or sitting with little other activity. A lot of my patients may have jobs in which they're standing on their feet for prolonged periods of time during the day or sitting at a desk, and they can't get up and take many breaks. Patients who are involved in a lot of heavy lifting, pregnancy, smoking, cancer has an association with vein disease. Prior blood clots, where that clot that's been in those veins can sometimes scar along the vein wall and scar at those valves, causing them to become non-functional. Prior trauma and obesity, and a family history of vein disease. So some symptoms of vein disease that we'll go over here are clearly variable. They can include leg swelling and heaviness and kind of achiness as the day progresses. Some patients complain of muscle cramps or Charlie horses, and occasionally progression to itchy, dry skin. Skin changes can also develop with vein disease, including what we see as different vein changes on the skin surface. We have spider varicose veins, which are very small, tiny veins at that skin surface, often a very faint pink or purple color, occasionally blue. Varicose veins, venous stasis dermatitis, and venous stasis ulcers. I like to go through these at this point and show some pictures for examples. Spider varicose veins, as I started to mention, are very tiny veins at the surface of the skin, and you can see that demonstrated in this picture here on the left. They are areas of red, blue, and purple lines that develop these tiny veins that are discolored, and it's due to a high pressure in the vein system, sort of a physical exam finding of vein disease. Varicose veins, as you can see in this picture, are a little bit deeper under the skin surface, almost sometimes looks like little worms under your skin. The most common cause of this is that you have that deeper mechanical issue of these valves failing in the legs of the veins, allowing that flow in the wrong direction, as in towards your feet and towards the skin surface. So when a patient stands up, the valves that normally would bring that blood to a halt at that point when they're non-functional will let that blood fall back down the leg towards your foot. And as the blood should be flowing up in that vein, this is again what we call venous reflux. It's that inappropriate direction of blood flow in the vein system. The path of least resistance from these superficial veins that are closer to the skin surface, where that valve function is typically noted to be inaccurate, non-functional, the path of least resistance is towards the skin surface. And over time, with a lot of pressure in those veins, we see them dilate to the point where we can notice them clearly, as in this picture, and call them varicose veins. So this is an example of a surgery center patient that we've treated that showing before and after pictures of their varicose vein treatment. Clearly on the left, there are some large prominent varicose veins, and after undergoing surgery, which is of course minimally invasive, we see that those varicose veins are no longer visible at that skin surface. Venous stasis dermatitis is a physical exam finding again, in which, as you can see in these pictures, there's a change in the skin color. The skin that's often around or above your ankles, sometimes extending all the way up to the knees, has a different hue to it that can be anywhere from reddish to yellowish to browns. I've even seen some patients where it's a deep reddish purple blue color that can be circumferential all the way around the leg, extending again from your ankles up towards your knees. The skin can also be thickened around these areas, and we can notice hair loss on the ankles and shins. The concern with venous stasis dermatitis, skin changes, and venous disease in general is how it can progress to venous stasis ulcers. As you can see in the pictures here, some worsening swelling that is kind of pooled within the skin. Ultimately, the skin will thin and it can no longer hold all that fluid. As the skin thins and breaks down, that fluid in the leg causing all your swelling and discomfort can actually start to weep through the skin. Sometimes a discharge develops and we progress to these open wounds that we call venous stasis ulcers. They're more commonly located around the ankle or on the calf. So testing for venous disease is very simple with an ultrasound that's looking to see if we can identify venous reflux. In this non-invasive test, we can actually see the direction of blood flow in the veins to identify if it is able to be stopped by functioning valves or if the blood flow continues in that wrong direction to identify venous reflux. This is an important test because this determines what treatment is indicated based on each patient's needs. There are non-surgical treatment options for vein disease as well. And one important one is compression stockings. It's important to know that these need to be prescribed by a physician, as patients need to have their artery blood flow checked prior to putting on compression stockings. These compression stockings come in different strengths of compression and are recommended for different strengths for different patients based on the extent of vein disease that is present. If a patient has poor artery blood flow, which is blood carried towards the legs and the feet, and again, veins bring that back to the heart, but with poor arterial blood flow, if a patient puts on compression stockings that are too tight, this can actually induce some arterial insufficiency wounds, which we wouldn't really want to happen. Exercise is an important part of treatment of vein disease because, again, the calf muscle is really critical with every step we take to help improve circulation and help to decrease swelling in the legs, which is going to decrease symptoms of vein disease. Elevation is also an important aspect because when you're able to elevate your legs above the level of your heart, gravity is able to help decrease swelling in those legs as well. As you can see by my picture here, I'm a big proponent of compression stockings. I actually wear what I prescribe for patients, which is 20 to 30 millimeter mercury pressure most commonly. You can see that I wear knee-high stockings. I have a pair for every day of the week and an extra. And I like to get them in a variety of colors and patterns just for fun. Surgical treatment of vein disease is a few different options. In our office, we focus on the core problem, if it's present, which is the venous reflux, and then symptomatic varicose veins on the skin level, excuse me, which can sometimes cause some irritation at the skin, be very sensitive to touch, and cause some pain as well. To treat the main mechanical problem of venous reflux in these veins is with a laser treatment we call an endovenous laser treatment, or EVLT. This is a minimally invasive procedure in which a heat that is applied to the inside of the vein from the laser will, in a way, you could say, burn the inside of that vein, and the scarring that it induces will ultimately close that vein shut to a complete scar with no blood flow through there, which will eliminate leg symptoms that you're having, and it will actually eliminate your bulging varicose veins. To remove varicose veins that are symptomatic, we do this through tiny incisions called a microphlebectomy. There's no stitches that are required for this, and to help things maintain their cosmetic appeal, we place a steri-strip tape across that at the end of the procedure, which falls off in its own at a week or two. So again, kind of explaining further what is endovenous laser treatment, a minimally invasive procedure, and this high energy laser fiber that is purposely placed into the specifically affected vein will administer the heat directly into that vein and cause it to scar shut completely and permanently. Ultrasound imaging is used during the procedure in order to make sure that the laser fiber is guided into the appropriate correct locations inside the appropriately identified affected veins. We also use ultrasound after the procedure to ensure that this procedure was successful and to evaluate to ensure there's no evidence of postoperative DVT or deep vein thrombus. Unlike some traditional procedures of vein stripping, the EVLT procedure requires no incisions, stitches, or general anesthesia, and this results in a procedure with less discomfort and downtime as a traditional vein stripping, but with the same very positive cosmetic results. On the left of my slide here, I tried to identify the timeline. At first, there's an initial consultation and ultrasound that's completed with a vascular surgeon. If a patient has not been prescribed and worn compression stockings, then there's a follow-up 3 months later to see how things improved or didn't improve with compression stocking use. Patients then are scheduled for procedures as soon as our insurances are all approved. And a few days after that, there is the first follow-up ultrasound. Again, as noted here, it's to ensure that the laser did what it was supposed to do and that there is no longer flow in that vein that was treated. And additionally, ensure that where the heat of the laser was applied, there did not become a blood clot that extended into the deep system of the veins, and which would, again, we call a DVT. There is a final ultrasound 1 month postoperatively that ensures those same items, that there is an ablated greater saphenous vein. That means that there's no flow through that vein and that we've scarred it closed, and again that there's no DVT evidence. So a little bit of the differences compared to a traditional vein stripping would be that this is a brief procedure. Treatment is in about an hour, sometimes less. It's an outpatient surgery, and it's often performed in a doctor's office type setting, such as our Columbia Surgical Associates Surgical Center. This is typically covered by insurances, including even Medicare, Medicaid. It provides a very fast relief of symptoms. I feel the very majority of my patients will come to that first follow-up appointment a few days after the procedure and note that they already can tell a difference in their leg, that it's not as swollen or heavy or achy and uncomfortable. This gives a potentially faster return to normal activities when compared with traditional surgery. In my picture on this slide to the left here, I love this picture to explain to patients because it's really helping to identify and put in their minds what would happen during surgery. You can see that this is the inside aspect of a right thigh, and at the lower end of the procedure, what looks like an IV catheter is passed through the vein, and initially this is passed all the way up towards the groin where it's identified as the saphenofemoral junction. The laser is started a little bit shy of this true junction to help decrease the chances of having a blood clot there, a DVT. Once the area that is planned to be treated, the length of the vein planned to be treated, is appropriately numbed with numbing medication, then the laser is turned on and very simply slowly pulled out. And the heat of that laser, again, will cause an irritation and scarring to the inside of that vein wall to ultimately scar this completely shut with no blood flow. And that's what this picture is sort of trying to explain as well, that the top portion of the vein from the groin to midway down the picture is a tighter, narrowed vessel that is different color, and then you see where it identifies the laser fiber midway, that section still needs to be treated. So the laser would continue to be slowly pulled out the vein until that's completed. And simply pressure is held at the access site, and you'll ultimately never see that, just like you often can't tell where you've had an IV or a blood draw on your arm done before. So vein disease, the important take-home points are that the symptoms of vein disease can vary per patient. Not everyone has swelling or heaviness or itchy skin, but it's often a combination of things. Untreated vein disease is important to recognize and hopefully seek treatment so that you prevent progression to those painful venous ulcers that I showed you. Minimally invasive treatment options are available to treat vein disease. And at Columbia Surgical Associates, we see, evaluate, and treat vein disease on truly a daily basis. I believe I had 4 vein patients I saw today even. And would develop a treatment plan tailored to each patient based on their needs and based on the findings from that initial ultrasound. So what's the next step? If you in this presentation, or by this presentation, excuse me, have recognized any vein disease in your legs, any symptoms that could be associated with vein disease, or if you've recognized this in someone that you know, the important thing to do is to realize that you don't have to continue to live with these symptoms. I encourage you to consider making an appointment with myself or my partners at Columbia Surgical Associates today to have an evaluation completed and begin your road to recovery. Our surgery center website has additional information available and clear instructions on how you can make an appointment. So if there are people out there, I'd be happy to take any questions that you may have. I wanted to jump here to our last slide to just thank everyone for joining us and apologize again for my technical difficulties. Just remember that at CSA, we keep it individualized per the patient. And we see and evaluate and treat patients on a regular basis, developing a plan specific for you. You can identify here our vein center phone number and our surgical center email and website information so that you can find more information out if you seek to find it that way. Not sure how I would see any. All right.